You're listening to the new WCEG Network on WCEGTalkRadio.com. Click Live Stream tab or watch us live on your smart TV. YouTube, WCEG Network. I'm Myrna Taylor Ransom, and today we have joining us on For Your Good, Dr. Adlene McElroy, and our traveling nurse, Nurse Pamela Davis. Happy New Year to everyone. Hope 2020 will be an awesome beginning of the new decade for you. We will begin our new year of For Your Good talking about love. It's said that love hurts, wounds, and ignites. And that's really the case when you get burned sexually with a sexually transmitted disease. We're the worldwide community empowerment group where we speak life into the community. Like us on Facebook. Join the conversation on Skype. Follow us on Twitter and on Instagram at WCEGTalkRadio.com at WCEG Network. Join the conversation. Skype in 1-678-619-1402. That's 1-678-619-1402. Ask your questions, make comments, or voice your comments. We love to hear from you. The topics and opinions are those of the show hosts, that would be me, and guests that are joining us, and not WCEG Network. That's our disclaimer. Thank you for your continued support. Today we're going to talk about HIV and other sexually transmitted diseases. And as I mentioned, we don't want to get burned by any of the sexually transmitted diseases because of love. So let's start talking today. Let's open up talking about HIV, since that's probably a lot more serious of the sexually transmitted diseases. And we're going to begin with Nurse Adlene McElroy. Thank you so much for joining us. She's the first time joiner this time. Thank you for joining us.
Thank you. It's very nice to be here, and I'm so excited to be participating in this conversation concerning HIV/AIDS and sexually transmitted diseases. You know, Myrna, when I was in high school, I was the only person on the opposite side of our debating team. Mm-hmm. And the topic was sexual intercourse before marriage is okay. That was the topic as seniors in our high school class, yes. And I was on the opposite side. I was the one saying, no, it's not appropriate to do that before marriage. And all of my entire classmates, the entire class,
they called you a prude, huh?
They were on the total opposite side of the game. So I hope by now, since a few years has come and gone, that they now understand the importance of being safe and protective when it comes to sexually being careful and mature and ready and prepared to take on such an adventure in life. HIV stands for Human Immunodeficiency Virus, and AIDS, stands for the Autoimmune Deficiency Syndrome. I'll share another story with you. I know of a situation where a young lady was dating a married man. The married man was HIV positive and was on antiviral medications.
Okay.
Apparently, perhaps, I don't know, it could be that he and his wife knew that he was HIV positive and that he was on treatment. But guess what? He never shared it with the girlfriend. The girlfriend contracted the disease and passed away. That's why what you stated at the very beginning of your prompt is so important, to don't get bitten by the sexually transmitted disease or HIV. And by the way, sexually transmitted diseases, there are a number of them. I won't outline them at
I
this
read
point in
there were
time.
more than 25
Exactly.
diseases that you can
Exactly.
contract through sexual intercourse.
And many of them you will never know you have them.
Some of them are silent.
Yes.
And the symptoms.
That's right.
Silent symptoms.
That's right. And if there's a sexually transmitted disease, it could now mean you are open to also be HIV positive.
Correct.
Because you can contract them the same way.
The same way, yes.
Wow. But now people are living longer. It used to be a fatal disease once you were diagnosed with HIV.
Yes.
We knew that AIDS was coming, and then death was certain.
Yes.
But now people are living longer with HIV and AIDS.
Yes. I'd like to add that as I came into the field of nursing in the early 80s, which is when AIDS hit the United States, I was assigned a patient that was an active HIV AIDS patient. I don't know, at that point in time, because it was newly on the scene, there were no antivirals at that point. So because I was a new grad, I suppose that's why I was caring for this patient. And I watched that patient suffer dearly.
Yeah.
And it was hard to watch. But I took care of him in a very compassionate manner because this is a human being I'm caring for. And from start to finish, I was dedicated to his comfort and his peace. And so that would be an experience that would forever be imprinted in my mind and in my experience.
And the disease symptoms can be quite ravaging on the body.
They can be horrible depending on what stage of development it is. Toward the end stage, I witnessed all of these symptoms with this particular patient. Rapid weight loss, recurring fevers. His fevers would never go away. He constantly had fevers. He experienced extreme, and I can understand. I couldn't explain why he was so tired and fatigued, but we do know that the disease is very ravaging. Mm-hmm. So that did occur. He had a lot of swelling, lymphatic swellings in his lower extremities and his upper extremities. Constant diarrhea, bloody diarrhea. Of course, with that constant battle of constantly pouring out liquid, you're going to be anemic. And it opened him up for the pneumocystis carinii, which is the pneumonia. He had the carcinosarcoma, which are the tumors that come along with AIDS.
Cancerous tumors.
Yes, cancerous tumors. And which now helps me to understand, but I watched him experience all of those symptoms. And of course, it makes their immune system is totally wiped out now. And
so
therefore,
anything they come in contact with, they can contract as
well. Absolutely. His dear sweet parents, and of course his partner at that time, were just devastated. So it
Did
becomes.
His partner ever contract this?
I don't know.
Disease? You don't know.
Don't know.
Okay.
And now I believe the teaching that's geared toward HIV and AIDS patients is that tell your partner. Don't keep that information from your partner. And I believe, I don't know for certain, I haven't had any contact with anyone recently, but I believe they are beginning to be more humanistic in that they are looking for a partner. If they are positive and on antiviral meds, they are looking for a partner who is also positive HIV and on antivirals.
But if the two people are HIV positive, they still have to wear protection.
Yes.
Because you can get another load of the disease.
Absolutely.
Correct.
Well,
I'm proud of you.
I worked there at one point.
I'm proud of you, Myrna. Actually, I was listening to you when you did, like you said, when you opened up and you talked about don't get bit by the love bug or whatever. Mm-hmm. Actually, love have absolutely nothing to do with it. We're just out practicing. And when they're practicing, it's not safe practicing. So therefore, we're going to get a lot of people that's going to come into contact. And I don't think people are doing what they should do as far as trying to protect themselves now because they feel as because we are in a different age now. Medication is here to help. They figure it's okay to go ahead and do whatever because now they feel like, well, if I get it, I'll live now because I have this medication. So they're still carefree. They're still carefree.
That's a bad thought there.
It's a bad thought.
Because you remember sometimes on the news some time ago, there were people that knew they were HIV positive, that were going around still engaging in unprotected sex. Now that's I guess almost murder.
I call that criminal, yes.
That's criminal.
I'm sorry to tell you that they're still doing that. And I do recall them, they had a case actually in Clayton County with a reverend. So not just Clayton County, they have them, people just everywhere. You have some people that's so upset that they contracted this virus or whatever, so they decide to take it out.
Everybody else's fault right now.
Right.
The fact that they engaged in unprotected sex.
And I recall speaking with a person just last year and a few years back, and they had the same answer. Well, that's what they get for being out here. And they had this beautiful, I remember this beautiful billboard they had in Clayton County. I don't know if it was anywhere else, but this beautiful young lady and this handsome young man, and would you talk to me and would you date me? And so many people was coming and, oh my gosh, she looks so good, he's so fine. But then when they said I have AIDS, it was one of those pump the brakes real quick type of thing. So you don't know what AIDS look like. You just can't look at someone and assume that they are okay. You have to ask. And if you ask, I pray they will tell you, but the ones who are on a different mission will not. Always remember that.
And so that concerns me when we talk about different dating apps.
Oh.
Because you can open up the door for a wide range of things in a dating app, and you don't really know these people. You don't know people that know them, or,
Right.
You're just kind of shooting in the dark at that point. So it probably will be interesting to find out how many people have either come in contact with someone with HIV or other sexually transmitted diseases, and is it more rampant now that you have these social dating apps and that you can meet more people and really get involved in a relationship on a dating app?
That would be a very interesting study to investigate that.
Actually, excuse me, there's one patient that I spoke with. They do have the ones that, just like you may go to a dialysis center, they have centers that people go to get their treatment and medication, and everybody know what they're there for, and they meet that way. So, and they introduce them and tell them about the places they go and the people they hang out with that's in the same, have the virus or whatever. So they meet that way. Before it's advertising it, no.
Yeah.
But they do meet each
other. But then the regular dating apps, not just an app for people that are HIV positive, but when you talk about regular dating apps, that could really open up a can of worms.
But if you think about it, you just can't put it up there. You just can't put an app out there and say, we're HIV and this is the app and come here. That's just like saying we're blind and I'm black and I'm white and I'm fat and you're skinny. So you just can't.
You can't really advertise that.
Right. You don't want to do it that way because that's like pointing the finger and judging. So you don't want to do it that way.
Yeah. But it would be interesting to find out.
Of course.
To what degree do you suppose the stigma is still there from the onset in the 80s?
I think it's still prevalent.
Yes.
It is.
I think it's really prevalent because that kind of blackballs you, so to speak, if you're labeled HIV positive or AIDS patient.
And also you have to think about it like this. If they had an app and you place your picture on the app and now you have a job, that opens up another can of worms.
Oh, yeah.
Because see, now you can be fired even though they say you're
confidentiality, HIPAA laws, and all of that comes into play.
We already know that those are being violated every day. Because I have witnessed people in hospitals where the doctors have said to them, well, you did such and such, such and such. That's what led to this particular infection or something, I have actually witnessed that. And it's been a while.
It's very insensitive,
Right.
My face probably said that.
Yeah.
Like I was like, you witnessed that.
Yeah,
Right.
yeah.
Mm-hmm.
And I won't go into it any further, but yeah.
Well,
yeah.
doctors, they know what can happen, what it looks like, and what you can do to prevent it. It's not that they want to be insensitive, but they're looking at, if I told you that stove was hot and you go touch it, so at some point in time, they kind of forget to show a little caring, a little love.
But you do that when you're alone with that patient. You don't do that when there's somebody else in the room. You don't know who that person is that's in the room, and yet you come in and just lay their illness out. Mm-hmm. You don't do that.
And I believe, now I believe when we want to be very sensitive to patients' personal information, we enter into the room and there's a crowd of people present. It's appropriate to ask the patient, is it okay to share information with you about your care in the presence of your visitors? And at that point, the patient will have a right to say, could my family please wait in the waiting room, all except whomever they choose.
Right.
Mm-hmm. And that's what's supposed to
happen.
That's
what's supposed to happen.
That's
I'm a witness that it doesn't always happen.
Yes.
And it's been a while, but I do know.
Well, it's not like it used to be for us that professionalism,
mm-hmm.
because you could walk into basically any hospital or doctor's office and see two professionals walking down the hall discussing that patient's
mm-hmm.
business, which we know we aren't supposed to do.
Well, and especially in teaching hospitals,
mm-hmm.
Which I'm kind of accustomed to. There's a certain amount of circular space around the team that rounds on patients. There's a certain amount of dignity and privacy expected. It's almost like pulling a curtain.
Right. And you're undressing the patient. So, pull the curtain.
Yeah.
And not only just pulling the curtain, but if you're pulling the curtain and this person is over here for a bad headache and this person is laying over here with HIV or whatever, lower your voice. Because you pulled the curtain and didn't close the ear.
Correct.
That's true.
Correct.
So we don't want to just sit here and talk about how many partners you had when you had this person over here.
Right.
They had to stop hurting because now they're listening. It's not like they...
Now they're distracted. So that
and not only that, at that point they may say, can I leave out of the room if they don't have that much knowledge? Because
mm-hmm.
people who don't have knowledge thinking they can just catch it by being in a room.
Mm-hmm.
Right.
Yeah.
There are still those who are misinformed. Now let's talk about that. Let's move right into that.
Mm-hmm.
Segue into that.
Mm-hmm.
Sex is not the only way you can contract HIV.
Correct.
There's blood transfusions. That's limited now because of the screening they do on blood that people donate.
Mm-hmm.
But then there's what is it? Blood. It's not just blood to blood.
Well, let's try a dentist's office. And
dentist's office.
You have open wounds.
Mm-hmm.
Yes.
Mm-hmm.
If they're not cleaning thoroughly the equipment.
Well, only if. Well, I shouldn't say only if. But you never know once you say only if.
That's right.
Mm-hmm.
A casual handshaking, no. A casually sitting on a commode, that's right. a clean commode. And you don't have broken skin at that point for anything to communicate into your...
Just in case you do.
But interesting enough, it's not in saliva according to CDC, but it is in the breast milk.
Right.
So
so you could kiss somebody with HIV and not contract it if you don't have any sores or anything.
Correct.
Right.
Mm-hmm.
Open
spots. Right.
Right.
Or gums in this midst.
Or gums.
Right.
Oh gosh. Yeah.
But you have to think about also when you say breast milk,
mm-hmm.
you have some guys. Lord forgive me. There are some people, I should say, that have a fetish for breast milk.
Oh, I didn't know that.
Really?
So therefore,
but this is an education, right?
So therefore, if besides babies or just didn't want breast milk, and there's other people that want breast milk, they need to be informed as well.
Yes.
Now that's a new angle. I hadn't thought about that. But people have fetishes for a lot of different things. And just because you don't, and you don't know anybody that does,
doesn't make it right or wrong.
It doesn't mean that it's right or wrong, but it doesn't even mean that it doesn't happen. Mm-hmm. It's still happening. And beyond your wildest imagination, some things are going on sexually that you just never thought about. But in all things, we want you to protect yourselves.
Yes.
You know, that's just the bottom line. You have to protect yourself. Now, in case you do end up unknowingly contracting the virus, HIV, what do? I understand now that there are some treatments that we didn't have 10, 20 years ago.
Pray. Go see the doctor.
That's number one. But there are some viral treatments now,
Yes.
antiviral treatments.
Yes. Just to dispel some of the ways HIV is transmitted. Of course, it's transmitted sexually, by sexual contact, by sharing needles or injections, and mothers to babies during pregnancy, birth, and breastfeeding. For example, when a mom, pregnant lady, comes to see her obstetrician, if she has HIV, that would be a good time to talk with your doctor. All right?
Because I understand when a woman is pregnant that the baby doesn't contract the virus while it's in the womb, but coming through the birth canal.
Correct. Just as babies can get syphilis as they come through the canal.
Through the canal.
So the baby gets a treatment of antiviral at the time of birth.
That's why it's so important to have those doctor visits.
That's right.
So they would know, because just a person just delivering a baby and never just didn't visit the doctor at all. There's a lot of things the team just have to scramble and try to do.
Yes.
And hope and pray for the best.
And that's not the only antiviral the baby gets at the birth. They get at various other increments throughout their newborn days, even as maybe 2 weeks, 3 weeks. They get 3 or 4 antiviral injections.
So a mother could actually have
or
HIV
treatments
and still deliver a healthy baby.
Yes, and that's encouraging.
Yeah,
very much so.
But we can't get HIV and AIDS through the air or the water. As we said, through saliva, sweat, tears, through a closed mouth kiss.
Could you repeat that again, please?
Sure.
Because I want them to know. I really want them to know. You know, because if you visit someone and they have AIDS, HIV, and you ask for a glass of water, and you find out later that you visited them 2-3 years ago.
Wow.
And again,
and then you start panicking, right?
Right.
That's right. And I pulled up some very recent research from CDC and the National Institute of Health. HIV is not transmitted by air or water. It is not transmitted by saliva, sweat, tears, or closed mouth kissing. It's not transmitted by insects or pets. And it's not transmitted by sharing toilets, food, or drinks. CDC.
So that kind of limits it back to everyday occurrences like sex.
Right.
Mostly, predominantly.
Right.
Contracting the virus is through sexual activity.
And they, like you mentioned earlier, the blood products are screened very, very carefully now.
Right. So you don't have to really worry about that.
Well, you can be concerned, but you don't have to worry. Just
Right. Well, that's the way what tennis player Arthur Ashe contracted. It was through blood transfusions. So. But that's very rare now because of the screening processes they take donated blood through. So.
I would like to put a note on the occurrence of AIDS, HIV, in the early 80s. I see one positive thing that came out of the disease coming on the scene. You may have never thought about this, but prior to the 80s, we had no personal protective equipments. The gloves, the foot covers, the head covers. Now they may have used that type of product equipment in the OR.
Right.
But as a population of healthcare providers, we didn't use gloves from patient to patients. We didn't change gloves.
I bet you do now.
We do now, and I believe it's as the onslaught of AIDS and HIV came on the scene, the what we call PPE, the personal protective equipment. That's one positive that came out of the epidemic.
Right, and you also have to treat everyone as if they have HIV.
A 91-year-old grandmother.
Because at one point, HIV was running rampant in the nursing homes.
Yes.
And personal care homes. That I found to be, I've worked At one point, I worked in media at the Centers for Disease Control and Prevention.
Mm-hmm.
And we had groups that would actually go and distribute condoms at nursing homes and personal care homes.
They're still
And
alive.
I had that was my first time hearing that. I was just so surprised that, but I guess, I mean, as I now am that age, or getting close to that age, it doesn't seem so strange.
Well, if you look at it, it used to be the teenagers, and everything in the middle, pretty much no. But the adults,
Right. Yeah. So
they don't think they have to practice anymore. Safe sex for some strange reason. They
They
feel
still believe that?
they feel that they don't have to practice safe sex, and it's amazing that they think that, because even with my clients, special need clients, they don't think they have to practice safe sex. They're like, we're just with
a lot
each
of
other.
Adults don't want to protect themselves because it's not skin to skin.
Mm-hmm.
And the skin to skin is what's important. They say
They
say condoms kind of dilute the
That's what the
feelings.
feeling. That's right, the sensation. But at the same time, they have
or
condoms.
block the feelings anyway.
They're blocking the feeling. They come to do a job. They come to do a job. Then get the job done. But they do have condoms that's very fine, that will actually work.
It's still not skin to skin. That's the complaint that I have heard from over the years. Is they want
And you know what?
skin.
And the moment you said that, they say, "Well, I don't like condoms," and the people that they're sleeping with, normally ladies, will say, "Well, okay then, just for those few minutes, it's okay. You're satisfied, but you have to think about it. How are you going to enjoy yourself?
If you contract some
Because you're going to have to continue thinking, and you'll never remember."
And on that note, teenagers have to be concerned about conceiving a child out of wedlock. Additionally,
Which, incidentally, people really don't seem to worry about that. I mean, I have had 2 teens this year, and it's just January, tell me about being pregnant. Come here and proud.
It's January 23rd.
It's not even. And it's like, okay, and they were so proud and happy. And I guess that normally for me that would be happy, but not as a teenager.
But
That
even if
changes
they
your
was
whole
35, if they're
and
proud,
prohibits a lot of things.
if they're teenager, 35, 55. God help you, 55. But at the same time, expecting a child is not like it used to be. It's a beautiful thing. God knows it's a beautiful thing. But when you just look at the study, so you slept with him and everybody else he slept with, that's what you have to think about.
That's right. And those condoms will break. So you need to not only use condoms, but a spermicidal gel in order to protect each other.
That will help. The feeling that they're not getting, use that gel.
Do you recall the book that Juanita
Really,
Bynum?
that helps.
In their mind,
Okay.
since they think they're not feeling, I'm sorry.
You mentioned of all the people they've slept with, I recall that Juanita Bynum wrote a book a few years ago about no more sheets. And it reminds me of all the number of people that individual has slept with. You're bringing all of those people with you everywhere you go.
All of them.
And whatever they had, you'll carry it with you.
And amazing that you say that, because you were just having a random conversation with anyone. And I'm going to say men, anyone, but just men. And you just said, could you remember who you slept with? And we're sitting here going, oh my God, you slept with her? But he's not going to tell you, because see, the person we look at that, he's like, her. But he's not going to tell you that because he saw your reaction. But if you think about it, that one person told you he slept with 3. Well, those 3 people slept with 40 more, and those 40 more slept with 40 more.
And they add up quickly.
Very.
They
Just
add
one.
up quickly.
One add up. One.
If
Just
it's the
one.
wrong one.
Just one person.
So if the one person that slept with 40 is dragging all of those over to this person. Now they have to add that 40 plus the ones they had. Is that it?
That's right. And that 40 slept with 40 and just continue to keep going.
That's a scary notion.
Of course. So that would make you want to get that gel and the condom.
Right.
Period.
Right. You're listening to WCEG Network, and this is For Your Good. I'm Myrna Taylor Ransom, and with me today we have traveling nurse Pamela Davis, and we have Dr. Adlene McElroy. And we're talking about sex today. I guess I got everybody's attention now that I have your attention.
You got mine.
We're talking about HIV and AIDS and other sexually transmitted diseases. And there are, as we discussed earlier, over 25 sexually transmitted diseases that you can contract through unprotected sex. And so we've kind of surmised here lately, based on all the information that we have, that it's not prudent or not very wise to just have unprotected sex. So we're not advocating anything other than not marriage, not single life, not anything. We're not advocating anything other than protection, your personal protection. And so let's talk about some of the other sexually transmitted diseases that we can contract through HIV, through unprotected sex.
Well, there's what?
So there's vaginitis,
Chlamydia,
chlamydia, syphilis,
gonorrhea.
Now, gonorrhea we refer to as
claps,
Okay.
which stays in your body so undetected for such a long time. And I recall us talking about this once before, and it can, if untreated, it can move places that you didn't know it could move to. We talked about the kneecap. You can have it in the mouth, the eyes,
contracting,
opening.
Yeah.
Yes.
Well, I know herpes. Herpes, you can contract that in your eyes. And I didn't quite, is it through contact or just through the disease being in your body or whatever?
Now, if you touch in places that you shouldn't touch and touch in your face, yes, but okay, let's keep it real with all adults here. If you're putting your face in places that shouldn't, well, I don't want to say shouldn't, it's your choice of placing it, then you're opening yourself up to disease to be
Just
where
like
there's opening areas.
Right.
So, any opening areas that you place your face, then you're open to the
If you're
disease.
opening it up,
Yes.
it's possible to
Yes.
get it in.
And it's not just women, it's not just men. We can catch it. Little people, I call children, little people can contract it. And you're like, wow, how can children contact, these diseases? But you'll be surprised.
That's what they're doing to pleasure themselves.
Or someone doing to them to pleasure themselves. And that's normally how doctors pretty much find out a child is being touched, because a lot of time parents don't know until a test come back. And then they look at the parents like, how do you didn't know?
We want to open up and have some of our listeners join in our conversation as well. So if you're listening to WCEG Network and WCEGTalkRadio.com, you can watch us live on your smart TV on YouTube, WCEG Network. And we're the worldwide empowerment community group. And we speak life into the community. And that's what we're talking about today, trying to make sure that you have long lives. You can like us on Facebook, follow us on Twitter, and on Instagram at WCEG Talk Radio and at WCEG Network. So Skype in, call us. The number 1-678-619-1402, and that's 1-678-619-1402. And you can ask us any questions you like or just make a comment. So we'd like to hear from our audience as well. The topics and opinions are those of the show hosts and guests, not WCEG Network. And thank you for joining us, and thank you for your continued support. We did not talk about the HIV treatments, but I understand now there are treatments that if you happen to have sex with someone the night before, you can get up in the morning after and take a medicine, an antiviral medicine, and it can wipe out the HIV in your body.
Well, it's best to take it at least 7 days before, knowing you're going to be sexually active.
Okay, you take it 7 days before.
But it's best to do it that way. Not saying you still can't take it, even if you forgot, get up and take it. But it's better to take it 7 days before because you're going to have sex. It's best to have it, to be on the safe side, if you will, if you want it to work effectively.
But there are antiviral drugs now that you can take to prevent HIV. That hasn't always been the case.
Prevention, even if you have a contact with someone that's HIV positive and begin a treatment, it's better to go ahead and begin it as soon as you know something. I mean, some people live very, very reckless, and why not already be on something if you're sexually active?
Right. That would make sense.
Definitely. Now, back in the early 80s, before all the research on antivirus were done, the patient in particular that I took care of in the hospital with active AIDS, of course, when HIV moves to active AIDS, that's like having a stage 4 cancer. HIV in the early stages, and we have to think about what stage it's in when it comes to HIV versus AIDS. The early exposure is a most appropriate and easy. Early stage of HIV is easier to treat when compared to others. Stage 1, acute HIV infection, is better to treat then. The latent period, there are no symptoms, and there's a very low viral load, and that's what we're thinking about, the viral load, meaning the T cell counts. The lower it is, the better your chances are of living with the HIV, and so the antivirus will keep you hopefully in the lower exposure level. So at that point, when your viral load is low, you have a less of an opportunity to transmit that disease to others because your viral load is very low.
And that's what the medication
that
does. It keeps everything low.
Low, yes. Mm-hmm.
So, can the antiviral drugs wipe out exposure?
It can make it so low that we can't say wipe it out, but it could be negative. It's still there. You still take the medication. We don't want to say wipe out, and a listener is like, oh my God, I took it. Now it's low. I don't have to take a medication anymore because it wiped it out. No, it can make it so low where it don't register, but still continue taking the medication.
And there were multiple antivirals, or back in the 80s when it first came on the scene, I think doctors used, because they didn't know enough about it, they used a lot of antibiotics because they were just trying to treat the symptoms. But now that they know a whole lot more about it, a person can get away with 1 or 2.
And antibiotics only treat bacteria.
Yes.
Antibiotics won't work on a viral disease.
It was a syndrome, meaning we don't know what's going on. We don't know how to treat this. But there's a lot of research now, and it's a much better day for patients with HIV.
And they're living longer. And they want to live, because at one time, a lot of people, if they got that positive from a doctor, they just said life was over or commit suicide. And there's a lot of people that got false positive.
Yes.
Yeah. And now that would be terrible if you end up with a false positive and then kill yourself.
Well, a little late once you do that, but it's always good to get a second opinion because things happen. And this is your life that you're talking about. So therefore, a lot of people don't want to get the test. And that's another thing that we have to talk about as well. Not, we're listening, but what about the people that's hearing impaired, that's special need?
So that's where you come in.
That's why I come in now. That's my job. at the same time, but even talking to them, all they see is the first word that you said was love. But I love him.
Right.
So I don't think I have to, and I'm going to do
Cover
whatever.
up and protect myself because I'm in love.
Right, because if he say don't do it or she say don't do it, they're not going to do it. And with the parents, all they want to do is like whatever my child want because they're a special need. They don't understand that it's so important. I mean, it doesn't have a age group or color. It don't have any of that.
Right.
We all can.
And you find out if you end up contracting it, then you see it has no color, no age group, no.
And they don't know how to explain their symptoms.
Yeah. Oh, okay.
So when they go to
a whole new.
Yes, a whole new ball game. And when I take my client to the doctors do not even attempt to ask.
Or really explain it to them.
They leave it to their personal.
Yeah, because they would not know how to communicate the disease or treatment or anything to them, I would think.
Well, I would think they would because they're treating that person, which still is special needs or hearing impaired. Mm-hmm. So you're supposed to know how. So in other words, again, there's, how can I put this? A doctor shouldn't say, I just want to have a patient that can hear, can walk, can see. A doctor is a doctor for everybody.
Right.
So he have to know how to. He may leave it to me or someone else. And it's best if they feel comfortable with the person that's with them to explain it to them, but they have to still give them that choice.
And then you have to go through all of the things like, well, it's not good for you to do this, this, or this because of the illness that you have. You kind of have to explain that to them, right? You
have to explain it to them, and keep in mind they have rights, and they're going to tell you what they like and what they want and what they're going to do. And you have to think of
stubborn there, huh?
Most definitely. Really? So then you have to use this reverse psychology, and you may have to use fruit. That's what I do. I put a banana out there, and don't touch that banana, and let all kinds of things happen to that banana, and then it was really pretty, and it start deteriorating. And then we come up with this conversation like, oh my God, that's exactly what happens when you don't use protection. You have to get there in a way you can.
Yeah.
So once you see that banana,
with the NFL, we would do, condom demonstrations, and you'd be surprised how many grown people don't know how to, put a condom on. There were all kinds of jokes and misnomers and misconceptions about wearing a condom. And basically they didn't know there was a stigma on the condom. You don't want to wear a condom. And, but you have to do what you have to do if you're going to take those risks, because you don't know who has the disease.
That's right.
You don't really know, unless it's somebody you run into that's active and you see fluids and other things prevalent, but you don't really know if the person's latent or the person's in remission, or you don't know.
Well, the CDC put out a report in 2016 that said 6 out of 7 people who have HIV don't even know it.
Don't even know it?
Don't know it.
So if you don't know it, how do you expect the other person
and
to
not only do they not know it, they don't want to know.
Yeah, I've heard that too. Well, if I have it, I don't want to know it. But
right, but after you explain it to them how long it can lay in your body dormant, right? So it can lay in your body forever, but
about 10 years too. It can lay dormant in your body.
Yes.
That's what they say, 10 years.
And you just not know.
Well, just imagine if it can lay in your body 10 years and you're a teenager and you have it.
Wow. By the time you become an adult, nothing's possible. You can't really enjoy your life. And I mean, you can, I guess, but there are complexities that you've added now to your life that you did not have before.
Right. And you have to be responsible. You have to go ahead and tell someone if you're talking to them, you're dating, you have to explain. And those questions, I don't know if they come up because I'm not on everybody's date, but you want to ask that question. You know, have you been tested? Or maybe your first date may want to be the health clinic and the second church.
Your first date may want to be at the health clinic.
Yes.
And your second visit,
church.
Maybe church.
And then we can go out to eat. Yes.
That's a good one, Pam.
Seriously, it's just because you really want to know, you want to be comfortable. You really want to be comfortable with each other. So I just say it's best to ask, even if you're joking around. Then when he laughs, but I'm serious. You know, you really want to know, because I told you the people that I spoke with, like, they didn't ask me, so I didn't tell them.
Wow.
So if you don't ask, they won't tell.
So then, what hope can we offer the younger children? I have a gentleman in our Sunday school class at church that is a teacher, and sexual education typically begins in high school or the 9th grade, but now they have dropped that to the 5th grade.
Really? Well, because Georgia has one of the highest rates in teen pregnancy. And, you know, in 5th grade, you what? 10? 10, and that's double digits. So you're not quite a teenager, but it's double digits, and a lot of things is going on. A lot of things are going on at that particular age.
Well, they dropped it, at 10 and 5th grade, as you say, a lot of young ladies' cycles are starting.
Yes, earlier.
A lot earlier, because, you know, they're gaining the weight.
That's
and
right.
And you're gaining the weight, it pushes other things, they throw things off. And before you know it, they're feeling some type of way, and someone told them they look a type of way. And
so now they think they're in love.
Exactly. They think they're in love, and before you know it, and that's how a lot of pregnancies are hidden.
That's right.
Because they was doing some things that they didn't know about. All they know, he was cute. He was fine. I'm sorry, he was bow-legged.
He played on the basketball team.
That's right. That's right.
Yeah, all of that.
Yes, and then before you know it, you have a baby you're in 8th grade, and you don't know anything about it, and then STDs come up, and you didn't know anything about those. Now you're going to be in a commercial or speaking at your school because of something happened that you weren't aware of.
Yeah, and that's unfortunate when something happens in your life that you could have prevented and you didn't. So it's best to be proactive about any kind of protection that can help save your life.
Yes.
I mean, it doesn't matter what it is. It doesn't matter if it's drugs or sex or whatever. Suicide, whatever, anything that's going to impact your life on that major level, you need to proactively protect yourself. We're talking about HIV/AIDS and other sexually transmitted diseases here on For Your Good. Why? Because it's for your good. This is WCEG Network on WCEGTalkRadio.com. We're going to take a short break, and we'll be back and continue our discussion and our education.